This is your teaching video for your upcoming abdominoplasty or similar body contouring surgery. The more prepared you are for your surgery, the easier everything goes. So watching these videos well in advance, reviewing your paperwork, and starting to plan ahead of time for things like caretakers and potentially child care or rides is always going to make everything easier down the line. If you have other medical conditions and required clearance from your primary care or a specialist, make sure you have these appointments made. We do not perform abdominoplasties or similar procedures in anyone who smokes. If you use any nicotine products, these need to be stopped at least 6 weeks prior to your surgery. Birth control pills can greatly increase the risk of blood clots, which is a more common complication, unfortunately, after an abdominoplasty surgery. We recommend people stop using their birth controls and start with an alternative form of birth control a full month prior to surgery. There's also likely some lab work or maybe even an EKG that needs to be completed prior to your pre-op appointment, and we will send you these prescriptions electronically if required for you. So I just want to stress again that if you're on oral birth control pills or estrogen, you should stop these 1 month prior to surgery. For birth control pills, be sure you use an alternative, effective form of birth control, and you can discuss this with your OBGYN. We can restart these postoperatively when your activity levels are more close to normal, maybe about 2 weeks post-op. If you use a hormone patch that contains estrogen, you don't need to stop these early. We usually just recommend you stop them the day prior to your surgery. 2 weeks prior to surgery, it's important to stop any over-the-counter blood thinners or herbal supplements, as typically these have not been tested to be safe with anesthesia. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oils, and vitamin E. It's also good for your body to reduce the alcohol that you're consuming. You can start fiber and a stool softener to prevent constipation. Review the teaching materials. Well, you're already on this video, but there is a medication guide specific for abdominoplasty that's important to watch as well. Create a question list and bring that with you to your pre-op appointment. Removing pubic hair through waxing can definitely decrease your risk of infection and increase your comfort during the healing phase. So we recommend doing this a couple of days prior to surgery. It's good to know that shaving actually increases your risk of infection, so we highly recommend against this. This would include surgeries like an abdominoplasty or circumferential procedure, and even C-section scar revisions or inner thigh lift. If you're having a brachioplasty, which is removing excess skin from your arms, we recommend waxing your armpit hair as well. Sometimes people get a folliculitis or inflammation of the hair follicles after waxing, so be sure to treat this aggressively with antibacterial soaps and let us know if this is a real problem prior to your surgery. We have a separate teaching video that will go over the over-the-counter and prescription medications in depth, and I highly recommend you watch that separately at least a couple of times. We want to get you on a bowel program that will help prevent constipation preoperatively. We will transmit your prescriptions the evening of your pre-op to your pharmacy, and this will likely include an anti-inflammatory, muscle relaxant, painkiller, anti-nausea medication, and a blood thinner shot. The night before surgery, it's important to understand what are called your NPO orders. And what that means is when's the last time you can safely eat or drink. Food and full liquids need to be stopped a full 8 hours prior to surgery. So to make things safe, we say don't eat anything after midnight. You can, however, continue to have clear liquids until 4 hours prior to surgery. Clear liquids include things like water, Gatorade, apple juice, tea, and sugar and honey is fine in that tea, black coffee, no milk or cream, and Jell-O as long as it doesn't have chunks in it. These can be taken up until 4 hours prior to surgery or 2 hours before you leave for the hospital. If you normally have coffee or tea every morning and that caffeine is part of your daily routine, it's a good idea to get a little in prior to surgery because patients oftentimes experience a caffeine withdrawal headache if they didn't get their regular dose. The night before surgery, you can also start your Arnica Forte and take your first antibacterial shower. Review your arrival time and place and all of your instructions. It's important you also review these with your caretaker. They need to watch this video. They also need to watch your medication video. You'll likely get a phone call from me, and if I go to your voicemail, I'll leave you a nice long message, and you might also get a phone call from your anesthesiologist if they get your information before it's too late in the evening to talk to you. The morning of surgery, you get to do your all-feared enema. If you've never done an enema before, you can practice the night before, but definitely do this the morning of your surgery and then take your second antibacterial shower. Be sure not to put any lotion on your surgical sites, and it's a good idea not to come into surgery wearing makeup. Bring easy clothes with you, like sweatpants and a hoodie, or something that's very easy to get in and out of. Be sure to bring your identification and also your garments. Leave these sitting out in pre-op holding. Not a bad idea to also bring your paperwork with you. If you're staying overnight, you want to bring a charger for your phone, your Arnica Forte, and pack 2 of those Lovenox shots. Also importantly, do not bring your pain medication prescriptions. You won't be taking your own prescriptions if you stay overnight. You'll be taking them from the pharmacy. After surgery, your positioning is really important. We want you to be comfortable, so that's how you know if you're in the best position possible. We describe this as a beach chair position where the legs are up a little bit and the back is up a little bit. If at home you don't have an adjustable bed, either invest in some wedges that can be used or go around the house and steal all the extra pillows so that you can stuff them under your legs and under your back to make yourself more comfortable. Now, some people at home prefer to sleep on the couch or a recliner after surgery, and that's just fine. It can definitely be easier to get up and walk around off the couch or out of a recliner. If you're having a circumferential procedure, like a belt lipectomy or body lift, it's important that you really baby your backside because you'll have an incision that goes all the way around. If you are trying to get out of bed, think of lifting your bum and resetting it rather than just dragging it across the bed. Also, when you're sitting down, keep your upper body more upright and do more of a deep knee bend. This is especially helpful when you're sitting down on a toilet. If you're too bent forward with your chest close to your knees, that's really putting a lot of tension on the back incision. So the more you're upright, the better that's going to heal. If you have liposuction on your backside, expect that you'll experience some drainage here. You might also see some pretty nasty bruises and swelling, and this is very common. If you had Renuvion or J-plasma, you also might feel what we call subcutaneous emphysema, or like there's some little Rice Krispies under your skin. There's nothing wrong, but it's just sort of a weird sensation that people may experience, and it should go away rather quickly. Because of the drainage, please protect your linens. That's the most important part of having liposuction. There are lots of things that we can do to help prevent blood clots, and we harp on this a lot with this surgery because it is a higher risk procedure. There are going to be white stockings placed on your legs with a second layer of an inflatable stocking that runs during surgery and while you're laying in bed after surgery in the hospital. We'll also use something called chemoprophylaxis, which are shots to help reduce the blood clots. In pre-op holding, you'll get a dose of heparin, and then post-operatively, we'll likely start a medication called Lovenox that is given approximately a week to a week and a half after your surgery on a daily basis. We also will use a longer-acting numbing medicine called Exparil, and this is injected into the muscle layer of your belly to help decrease your pain. This works for about 3 days post-operatively. It's important that you get up early and walk, and also frequently. You may have to ask the nurses to help you get up and walk when you feel ready after surgery, or you may have to put up with me or your nurses kind of cracking the whip to get you moving. I also recommend what I call bed aerobics while you're just laying in bed. Point and flex your feet pretty aggressively and pump your calf muscles. Also make circles with your ankles. This is all good for your circulation. Deep breathing is so important after this surgery. Taking a deep breath hurts when we've tightened your abdominal muscles, and it can also trigger a cough. So many patients try to avoid deep breathing and try to avoid those coughs, but believe it or not, those coughs are helping you to heal. So if it hurts, just put a pillow across your abdomen. We need you to practice these deep breaths. So you're going to wake up with this device called an incentive spirometer by your bedside. It helps you measure just how deep your breaths are. Similar to that game at the fair where you take a big mallet and bang it down and you see how high the level goes. So you need to be getting a minimum of 1,000 on this with every one of those deep breaths. And we recommend that you every hour work on taking 10 long, slow, deep breaths using this device. You'll also take it home with you and continue to use it the week after surgery. It's important for you to have a second device at home called a pulse oximeter. We use this in the hospital as well, and it shows us what your oxygenation is. It's important for patients to try to get their oxygenation levels above 90%. If you're in the lower 80s, we do need to send you home on oxygen. Getting up and walking is also excellent for your breathing because when you stand, your diaphragm lowers. It's okay for you to also open your garment if it feels tight and if it feels like it's restricting those deep breaths. So when you're just laying in bed, go ahead and unhook and unzip if that makes you more comfortable to take those deeper breaths. It's likely that you will have at least one drain and perhaps several depending on the type of surgery that you have. Drains can be really intimidating, but they actually serve a very good purpose to help you heal without complications. They're going to pull away the fluid or swelling that accumulates in the surgical site so the tissue has a better chance to heal. We use a pretty sophisticated dressing around the drain site where it exits your body. First, we place a biopatch, which kills all kinds of germs, and we hold it in place with a hypoallergenic tape called coverall. Sometimes there's drainage around this site, so we'll take an ABD pad, which is similar to a big maxi pad, tear it partially down this blue line, and then just tuck that around the drain site in case there's drainage, so it helps keep you cleaner. It's important that this dressing stay on. If it falls off when you're at home, you can cover it with an antibacterial ointment like bacitracin and put a Band-Aid around it, but give us a call so we can help replace this as soon as possible. It's important that you record how much comes out of your drain, and we will give you a log to help keep track of this in your pre-op paperwork. You want to strip it or inchworm down the stuff that's in the drain down into the bulb at least 3 times a day. If the volume is really high, you may have to do it more than 3 times a day because once that bulb starts getting full and is no longer collapsed, it's not really sucking the way it's designed. You may see pretty big differences between the volume that comes out of different drains. That is common, but what comes out the drains will probably all look pretty similar in color and consistency. We'll take these drains out when the output is less than 25 to 30 cc's over a 24-hour period. What comes out of the drains is initially going to look like blood, but it's actually a little more watery than blood. It's going to lighten up more to the consistency or appearance of red wine than cherry juice, and it might even get to a more golden color like apple juice. It's normal to see some white, stringy kind of fibers that are in the tubing or in the bulb. And it's also normal to see some long, stringy red clots that accumulate down in the tubing or in the bulb. What's not normal is that the blood is so thick, it is more like the consistency of jello and is very dark in color. That may be a sign of too much bleeding. Also, it shouldn't get really stinky. We all have a different opinion of what smells bad, and some people don't like the smell of blood. It's a little bit more of a metallic smell. That's normal. But if it gets more milky and smells like you need to run the garbage disposal or take the trash out, that is absolutely not normal, and we need to see you right away. Also, you may experience pain at the drain site. I put some long-acting numbing medicine here, but that wears off after about 3 days. If you're experiencing increasing pain at the drain site or redness, we need to see you early so that the drain site can be cleaned and adequately redressed. It's typically okay for you to shower as early as the next day, but because it can be pretty exhausting to do and painful to do, some people like to put it off for a couple days after surgery, which is totally fine. You do need to take your first or even the first couple showers with somebody there with you. So I say shower with a friend that you feel comfortable seeing you naked. You need to make the position changes pretty gradually when you're going to take a shower. When you take off your garment, your blood pressure is going to drop a little bit, so it's important to take it off and then kind of sit on the side of your bed. Then stand up and wait a minute. Make sure you get your sea legs before you go prancing right into the shower, because blood pressure is going to drop, and when you get in that warm water, it drops even more and you can get very lightheaded. It's great if you have a shower chair or something like that in case you need to sit down while you're in there. You want to leave all of the tape dressings on the incisions, but you can take off the garment and all of the pads. It's easy for you to put your drains on a lanyard around your neck so that you can turn and those aren't hanging and creating more discomfort. Remember that everything can get wet, but it's good to give it a chance to dry once you're done with the shower. So maybe just lay in bed for a little while and let all of those tapes dry off. And if you have a hairdryer that you can put on a cold setting, it's important that you don't use heat, you can dry off those drain dressings a little bit more quickly by using this. Remember that it's pretty exhausting to do this shower, so I wouldn't do it right before you're supposed to head off to an appointment or something, but maybe do it before bed when you can just rest. The real sneaky people time their shower after they have to take their garment off to have their first bowel movement. So that's something to keep in the back of your mind. Garments are a big part of body contouring surgery, and they should be tight enough to give you a hug, but not so tight you feel like it might be cutting off your circulation. We do place these big foam pads called toppy foam in there, and the goal of the toppy foam is to keep areas smooth and redistribute the tightness. We like to use them under the zippers and also between a surgery bra and the top of your garment if you're also using a surgery bra. Now, as time goes by, you can switch over to a Spanx or a cotton camisole underneath the garment instead of this foam, but don't throw it away because you might want to go back to it. You don't have to call us to ask us if you can stop the toppy foam. Try to use it for at least until your first follow-up appointment if possible. Now remember, when you're just sleeping, it's fine for you to unzip and unhook your garment, but you'll notice that you're more comfortable as the days go by with it tight when you get up to walk. The garments may get kind of gross, and definitely the sticky side of the toppy foam where the silicone is can also get kind of gross. So know that you can wash your garment, and you can also rinse out these toppy foams that get a little blood staining on them, and to continue to use them if necessary. It's important to also understand your restrictions following surgery. Don't lay in bed all of the time. That's the bad thing. You do want to get up and walk a lot. You want to work on your deep breathing, and you want to sleep in whatever position is most comfortable for you. Now, it will hurt to lift things, so just don't pick up anything that hurts. I think it's pretty safe to say stay under 10 pounds for the first few weeks after surgery. Coughing also hurts, but coughing is good for you. If you need to cough, hold a pillow across your tummy so that you can cough with a little bit of support. It's important to also avoid any extreme temperatures on your skin. You never want to use a heating pad or an ice pad directly on your abdominal skin that just had surgery. Also, while walking is good for you, I say walk in circles so you don't get too far from home. Walk kind of in a clover leaf pattern, like around that block and then another block, so you're always getting closer to home in case you get too tired. There's no cardio recommended for 6 weeks, and if you are a heavy weight lifter doing things like boot camp class or Orange Theory, you want to avoid that for 3 months post-op. It's normal for you to have discomfort or pain after this surgery. It's also normal for you to be really exhausted. You should expect to see some bruising. You'll see bruising on your abdomen and posteriorly, especially where things are dependent, like down around your labia or genitalia on your tailbone, and you should expect to see some swelling at your feet. So keep using those white stockings if they help not to let your toes turn into little sausages. You'll also put on a lot of water weight right after this surgery, so don't weigh yourself. You'll notice that your face is puffy, your hands are puffy. You're probably going to weigh 10 pounds more. So this will go away over the first couple weeks, so don't worry about it. It's also normal to have a lot of itchiness, and when you're wearing a garment, things get kind of hot underneath there. You might have some irritation from the tape or the prep, and sometimes medications cause some itchiness as well. If you start developing a rash, though, that's not normal, and we will talk about that in a minute. Take those deep breaths that make you cough. The coughing isn't bad. The coughing is actually good for you. Things that are concerning is if you experience excessive bleeding in a surgical site. Your first tip-off is what's coming out of the drain. If the drain fills up instantly and it's not more watery like red wine or cherry juice, but thick like that Jell-O, that can be a problem. It could be a sign that there's too much bleeding in the surgical site. You might also see some swelling begin in your abdomen that's firm to the touch or excessively bruised. If you're having any problems with something like this and you have questions, let us know as soon as possible. Also, it's normal to have a low-grade temperature after a surgery like this. 99 to 100 is not concerning, but if it gets closer to that 101 mark, please let us know. People can get a little contact dermatitis that causes a rash, but if you're getting a rash on your extremities and on your face that aren't related to the incision sites, that could be a sign of a drug allergy or an allergic reaction to some of your medications. If that happens, stop taking everything except for antihistamines like the Zyrtec or Claritin and even Benadryl. Let us know as soon as possible so we can help you troubleshoot this. Now, sometimes this is combined with surgeries in your chest, so you might be a little sore in your chest, but if you get a sharp stabbing chest pain that comes out of nowhere, that's persistent, along with shortness of breath, that's not normal. That could be a sign of a pulmonary embolus, and that's an emergency that you need to let us know right away. Now, you might also have some swelling in your extremities like we talked about, but if you have persistent pain and more swelling in one leg than the other, that's pretty obvious. That could be a sign of a blood clot. Also, if you have a persistent headache that doesn't go away, despite taking some pain meds, making sure you're hydrated, and that you've had some caffeine, that can be a sign of hypoxia. So this is where you're going to use your pulse oximeter and see what your oxygen levels are. They should be in the high 80s to 90s. That would be common. If they're dropping into the mid 80s or lower, you need some supplemental oxygen. Remember that working on your incentive spirometer is the best thing to do if you're a little borderline on your oxygenation. It's hard to know when you're going to be ready to drive. I'd say in general, most patients don't drive for the first 2 weeks after an abdominoplasty. You definitely need to be off all of your narcotics and Valium, I would say for at least 24 hours. Use good judgment when you're going to drive because your reaction time is going to be slow. Your first follow-up appointment will likely be at about 4 or 5 days after surgery. Be sure to bring in your drain logs, and we might be able to remove any drains that are below 30 cc's in a 24-hour period. So we want to get these out as soon as possible for you. This is a great time to go over any questions that you have, including medications and activities. You might also bring some of the second stage garments that you've collected. We typically are going to make this switch when all of your drains are out, but we can certainly look at them to see if you've made good purchases. Second stage garments can be used once you've started to heal up, especially after your drains are removed. Sometimes all the zippers and lace and everything on your surgical garment doesn't really go well under your clothes. So a second stage garment, which is typically like a Spanx or similar product, can give you that little bit of support without too much bulk. If you have a brachioplasty or liposuction on your upper back area, make sure you're also using compression in these areas more long-term as well. You'll have your second follow-up probably around a week later, and likely you still may need a ride to this appointment as well. We will remove the tape dressings at this appointment and start wound care on incisions that still need a little bit of help, and talk to you about your scar care, which you can start after your next couple of showers. It's a good idea for us to confirm that you're not taking any of your prescription pain medications or Valium anymore, or at least making a big effort to wean these down. We can also go over what activities are more appropriate at this level of recovery. Good job, you are prepared. Make sure you've also watched the medication video for abdominoplasty. Bring in a list of questions that weren't covered adequately for you. Educate your caregivers so they are ready to hit the ground running. And by all means, make sure you take enough time to heal for a surgery like this. People who go back to work too early or are responsible for small children during the healing phase definitely take longer to heal.